This meeting is being recorded.
Okay, welcome everybody. It is September 13th, 2023. Every Wednesday night we have Dr. Wallach here at 8:30 p.m. Eastern Time. And I'd like to welcome you all to this 30-minute meeting we have. And we'd like to say that legally, this meeting is for educational and entertainment purposes only. What you hear tonight is not intended to diagnose, treat, or cure. That being said, it takes great discipline and changes in our mindset and habits to have these protocols work. We are here to seek true science-based clinical advice on the use of nutrition and to feel better. If you have the desire to make a 90-day change in your lifestyle, you've come to the right place. Dr. Wallach's research and the development team has created an army while raising his family on the road and other things that people can do if they have a mind to do that. So to be respectful, we just ask you to all please write down your questions, and at the last 15 minutes, Dr. Wallach will finish his explanation on the topic he's going to talk about tonight, and then we'll open up the lines for questions. I thank you all for coming, and Dr. Wallach, the call is yours.
Okay, well, thank you so much, Pam. I'm going to talk about trigeminal neuralgia. Very painful on the cheek. You have some eye issues and on the jaw, okay? There's three branches to the fifth cranial nerve, the trigeminal nerve, the one that deals with the eye, the one that deals with the cheek, and the one that deals with the jaw. And there's a fourth nerve, which is a motor nerve, okay? That's attached to the fifth cranial nerve, the trigeminal nerve. It's one of the biggest nerves as far as actual diameter and weight and all that kind of stuff, because it deals with so many issues, okay? And this is very simple to give it what it needs. What you need to do is get rid of all the bad foods: no fried foods, no processed meats, no oils, no glutens, no wheat, bran, rye, oats, no sugar, no carbonated drinks. Even the diet drinks got to go, and the carbonated water, because they neutralize stomach acids, so you cannot absorb minerals or digest food. Then you need to make sure you're taking, let's say, per 100 pounds of body weight, the 90 essential nutrients. The Healthy Brain and Heart Pack. I like the big hammer, the Healthy Brain and Heart Pack. If you weigh 140 pounds like I do, I take 2 Healthy Brain and Heart Packs per month, full dose everything twice a day. Then a minimum of 1 bottle or maybe 2 bottles of the MSM, and they support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone, makes bone cell, and bone marrow. Okay, so you're making white blood cells, you're making, let's see here, making red blood cells, making platelets, okay, also making antibodies. And so this is a very important product, okay? And when you have something like trigeminal neuralgia, then of course, you also want to have anything to do with nerves, okay? And that's where the I-26 comes in. It gives you the raw materials to make the myelin, the white matter of the brain, spinal cord. And so this is very, very important when you have osteoporosis of the skull, squeezing those 12 pairs of cranial nerves in the spinal cord. And the trigeminal nerve is extremely painful. And doctors just like to let's just cut the nerve. Well, give us 90 days. And the odds are you won't want to cut the nerve because you want all those functions, okay, that the fifth cranial nerve gives you. But you do have to, treat it well, get rid of the bad stuff, give it everything it needs to maintain itself and do its job. Okay, this is not difficult. Okay, and we deal with the trigeminal nerve, I don't know, probably 100 times a month. We're in 80 countries. We're working on getting 35 more countries in, one big organization. And it's one of those things where you got to give the body the raw materials. And they learned this 3,000 years ago when they first started making salt from boiling salt water and boiling off the water and getting the salt, and they'd give it to people inland away from the ocean. And people would goiter. The goiter would go away when they gave them salt water. Okay. And why is that? Well, that's because it had the minerals in there that were necessary to make the thyroid happy. Okay. And so when you make the thyroid happy, the goiter goes away. And so we learned that 3,000 years ago. And so that's one of the first, which I say sort of awareness that you could cure diseases with certain foods. Okay. And so it's one of those things where salt is essentially essential. You make stomach acid from salt. It's required by every cell in your body to do functions, talk to the various parts of the cell, neighbor cells, and so forth. The salt is absolutely essential. And people who say, well, my doctor says I can't have salt because I'll get high blood pressure. Well, you need to change doctors, okay, because the doctor's got misinformation there. Okay, and let's see here. It's one of those things where, again, it's very, very easy to deal with trigeminal neuralgia and the other issues. We got the book. It's all in your head. Okay, and when you get the book, it's all in your head, you'll understand why you get this trigeminal neuralgia. The top picture is a skull at autopsy. The top of the skull has been removed. You see the skull is a quarter of an inch thick. The bottom skull is also at autopsy. They removed the top of the skull. You're looking down on the brain. But this skull is 1.5 to 2 inches thick because it has osteoporosis. You can see everybody squeezing all the nerves, this, that, and the other. And there's 12 pairs of cranial nerves, and each chapter in this book represents a cranial nerve. Okay, and there's a CD that goes along with it, which deals primarily with the spinal cord. Okay, and so this is a very complete book when it comes to the 135, 137 different diseases you can get when you have osteoporosis of the skull. Okay, it's not difficult. You understand it. You need the nutrients to maintain the myelin. Okay, and we have the I-26. The I-26, the Healthy Brain and Heart Pack, and that's where I like to go for those. And of course, we have secret sauces for each, what should I say, each cluster of organs that are involved. We have sweeties when you have diabetes. Well, sweeties is required by every cell in the body because diabetes affects every cell in the body. Okay, it's not a genetic disease. It's very simple nutritional deficiency, just like goiter is very simple nutritional deficiencies. Same way with things like Parkinson's disease. We're working on Parkinson's disease. We found the cause, prevention, and cure for Parkinson's disease. We have a big flip chart coming out, 73 pages, and when one of the discussions is on Parkinson's disease because we believe we have found the cause, prevention, and cure for Parkinson's disease. It's not a genetic disease. It's not an old person's disease. It's a very, very simple disease when you really look at what's happening. We have a gal by the name of, let's see here, Madison. She had Parkinson's disease for 11 years. She would go to a Rush Medical Center, okay, and she would get tested for an annual physical. And each time for 11 years, Parkinson's disease, Parkinson's disease, Parkinson's disease. Well, we got her on our program. And then on 12th year, she goes in for her annual physical and they couldn't find it. And they said, you better come back tomorrow. Our machines aren't working. So she went back the next day and it still didn't have it. So they said, okay, don't take any more of our medicine. We'll give you an appointment for next year. Bye. Okay. Okay. So at any rate, I thought that was kind of a funny story from Rush Medical School. Okay. And so it's one of those things where in this flip chart we have coming out in a couple of weeks, the story of our Parkinson's disease and how we figured out the cause, prevention, and cure of Parkinson's disease. We're very excited about that. We're very proud of that. And it goes in with our other things where we found the cause, prevention, and cure of cystic fibrosis. We found the cause, prevention, and cure of muscular dystrophy. We found the cause, prevention of sudden death syndrome. Okay. And I received all kinds of national and international awards for that. Well, I guarantee you, somebody's going to say something nice about us when this full package comes out on Parkinson's disease. Right now in America, we have 1 million identified Parkinson's disease patients. We have 90,000 new cases every month. There's a year, every year, 90,000 new cases every year. Excuse me. And we have 37,000 37,000 that right? Yeah, 37,000 deaths every year from Parkinson's disease in America. 37,000. Okay, so this is all going to end because we know the answer to it now. And when this flip chart comes out, it's going to go like wildfire. So be ready. Okay, over to you, Pam or Dave. Hello, Pam or Dave. Anybody home? Can you hear me, Laura?
Hi, Doc. Yeah, I can hear you. I just sent Pam a text to let her know that you're finished with your speech.
In my monologue, yeah.
Yeah.
I'm here, Doc. I'm here.
Okay.
Thank you, Laura. Thanks, Doc. Sorry about that. Technical issues, right?
Yep.
We love this technology. So the flip chart is at the printer, right?
It's at the printer. We're so excited about it.
Excellent. 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 Can't wait till that comes out. So let me ask a question. Randy, are you on here? You know, Randy, my buddy Randy in South Dakota, he's usually on here every week. He's got some pain in his jaw. He's been dealing with for quite some time. He had all his teeth pulled last year, and he got dentures, and he had this pain, and they treated him with some antibiotics. But you know, I'm wondering if he's wondering if they didn't kill the infection before, you know, everything healed up, because he still has the pain.
David, he needs to get an MRI of the skull and see if he has osteoporosis of the skull, squeezing that fifth cranial nerve.
All right. Will they know that?
They don't know that. We just need to know if he's got osteoporosis of the skull. They can tell from an MRI.
By the thickness of the skull, right?
That's correct. See, normal skull is 1/4 inch thick. When you have osteoporosis of the skull, it gets 1.5 inches to 2 inches thick.
Right. Now, you mentioned before Paget's disease. What do they say that is?
Parkinson's disease?
Yeah, Paget's disease. Isn't that osteoporosis of the skull?
Well, I guess it can be. Okay. It depends on what nerve it's squeezing.
I'm not sure how it manifests. I thought I heard you mention that before, and you said that it was. And
I'll look it up again.
Okay, I think Randy might be suffering from that trigeminal neuralgia, and he's not been wearing his lower dentures, but he still has that pain.
Does he go by JR? Does he go by JR?
No. I think he goes by Randy. He usually has his camera on. He's a farmer. He's either in his tractor or on his motorcycle at the farm. You've seen him. Anyway, he may not be on here. I did send him a text, but we were talking about it earlier today, that, you know, he needs to be treating himself for the, you know, osteoporosis of the skull. And he's got a pretty good regimen. So I think he's going to start seeing some results. So.
Okay, good.
Yes. So I can't see the board. So is there any hands up, or does anybody have any questions for Doc? If you're muted, press *6 to unmute.
Oh, hi, Doc. This is Ken over by Dave and the Thumb.
Okay.
I've got a friend here, Judy. She's having some trouble with her right eye. She can explain.
Yeah, hi.
Hi.
This
Do you have
is
a
Judy. What's your
diagnosis?
name?
Do you have a diagnosis?
Yeah. It's like a blepharospasm on my eye, the right eye, where my eye, top and bottom eyelid are twitching all the time. I've had it for like 23 years.
Okay.
And
Okay.
I
How old
had
are
it,
you? Wait a minute.
controlled with Botox.
Judy. Judy, how old are you?
Yeah. Oh, I am 72.
Okay. And how much do you weigh?
109 pounds.
Okay. How many times a night you wake up to urinate? Once, 3 times, 5 times?
Once.
Okay. Do you have any ringing in your ears? Any tinnitus or ringing or buzzing in your ears?
No.
Okay, good. Do you have any balance problems where you need a crutch or a cane or anything, a
No.
wheelchair, walker?
No.
Okay. What about your voice? Has your voice changed? Have you lost your sense of taste?
No.
Okay, good. All right. Well, this may be due to osteoporosis of the skull. Okay, squeezing the nerves that go to the eyes and causing that tremors.
Oh, my.
Okay, you might also have
Uh-huh.
Parkinson's disease. Parkinson's disease
Okay.
causes tremors and
Mhm.
shaking and stuff like that.
Okay.
Okay. Do you have any other issues that might indicate Parkinson's disease? Like, do you have any memory problems, anything like that?
No. No.
Okay, good.
The issues I have are stomach issue. Well, it started with my throat with acid reflux, and I have scarring, and food was getting stuck. I don't know if this would have anything to do with anything, but anyway, that cleared up and then it stuck. And then a big concern of mine is I think my sphincter that goes to my stomach, the food's not getting in there because it's closed, it's shut.
Mhm.
And
Yeah,
when I
okay.
eat, the food
Stop.
just sits there and then drips
Okay,
into my
stop.
stomach. And I've
Stop.
lost a lot of weight.
Stop.
Okay.
Stop. Stop. Okay, I've got it figured out now. This is the ninth
Okay.
cranial nerve being squeezed, and so it's dealing with your swallowing and your taste and all that kind of stuff. Okay.
Yeah.
Okay. And that's dealing with your taste and your swallowing. Also, you do have other issues. This and the eye issue, the tremors. So I also want you to add to your program our I-26. This helps rebuild the brain. I-26, the initial I,
Okay.
not EYE, but the initial I. Okay.
Okay. All right. Got it.
I-26, and
Uh-huh.
take your body weight, 100 pounds or so. I'd have you take.
Mm-hmm.
We have chewables, pills, and powder. If you're going to take the chewables, which I like, take 2 of those 3 times a day. They come in French vanilla, very, very soft, gummy chewies. Okay, and they also come in banana coconut. Okay.
Okay.
They come in capsules. They also come in powder. I personally like the chewables. Okay.
Mm-hmm.
So you got to do those, and take the Healthy Brain and Heart Pack, one of those a month. So you can take a half a dose of everything at breakfast, half a dose of everything at dinner time. I would also take the Occutive, or eye product called Occutive. Okay. Take 2 or 3 of those twice a day. We 2 bottles a month, or small bottles. Okay.
All right.
And then call us on a regular basis and let us know what's happening, and we'll walk you through this. The odds are you have osteoporosis of the skull causing these various problems, all of which are caused by the skull squeezing these cranial nerves, the spinal cord, and of course, when you're talking about other things, you're okay.
Restless legs. I have really bad restless legs. Is that part of it too?
Yeah, restless leg syndrome.
Night?
Yeah, that's the skull. That's the skull squeezing the spinal cord.
Oh wow! Oh my God! Wow. Okay. Well, I'll take all that stuff.
Yeah, that'll all go away. That'll all go away. Okay. That restless leg is the skull squeezing the spinal cord.
Oh.
That works through you.
Yeah. Okay. All righty, and that's it.
Well, that's a start, but you got to stay away from the bad stuff so you can absorb everything. No gluten, no wheat, brown oats, no buckwheat, no sugar, no carbonated drinks. Okay, none of that stuff.
Okay.
Okay, and let's hear from you. Okay.
All righty. Okay. Wow. I'll tune in next week.
Okay. Yeah.
Thank you so much.
And Judy, we'll make sure that that Ken gets a list of this stuff and a list of the bad
Oh.
foods so you can avoid that stuff, okay?
Oh, thank you. I appreciate it. I really do. Oh my gosh.
You're welcome.
Yeah. Okay. All
Oh,
right.
you're welcome, Tim. You're welcome, Judy.
Okay. All right. Thank you. Bye-bye.
You're welcome. Okay, anybody else have any questions for Doc? I'm not sure how much time we got left. I can't see my clock on my phone. Doc, you got a timer there?
We got about 7 minutes left if you want it.
Okay, wonderful. Any other questions, folks? We're running
David,
out of
I had a
time here.
question for the lady that was on just now, Judy. Did she say she had Botox? Is that what I heard?
She did say she was treating her eye tremors with Botox.
Doc, could you elaborate on what Botox is?
Well, it's a prescription medication to relieve symptoms, okay, of inflammation, okay? And so I'd have to get my book out because I don't prescribe it and all that kind of stuff. So I'd have to get the book out to get all the stuff. But Botox,
Doc.
huh?
Doc, it's botulism, remember? And they use it to like numb the body, numb the skin or something. And it like they use it for wrinkles, and I didn't know they used it for tremors, but that's a new one on me too.
Yeah. And so, yeah, Botox, that's right. They use the botulinum toxin and make a drug out of it. That'll make you feel comfortable.
Yikes. And botulism is a deadly toxin, right?
Yeah, exactly.
Thank you, Dr.
Now,
Wallach. I had heard that. So I really am glad that David, maybe that's where we heard it. We heard it on somebody's show. And, we talked to a lot of people. And when I heard about, botulism and Botox and all these other types of things, it really was not fun to frequent, different doctors. So I'm really glad that you kind of cued us in, Dr. Wallach, on using natural alternatives, which are organic to, the soil. And could you elaborate a little bit on the soil? I think after Laura asked her question here. I yield.
Okay, well, the soil obviously is different from one place to the other. Nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. Okay, you can be eating a carrot salad and your twin sister or twin brother doesn't have any problems, and that's their favorite, and you're eating that same carrot salad, and you're going blind. And the doctor says it's a genetic disease. Well, how can it be a genetic disease if you've got it and your twin sister doesn't have it? Okay, and so doctors really know nothing about nutrition and soils and that kind of stuff. Soils are very complicated things because what they're made out of depends on if they're near a river, if they're near a volcano, if they're near a factory, if they're near a farm, all that kind of stuff. And we were getting our minerals, okay, from wood ashes and coal ashes 3,000 years ago. And let's see here, at 3 o'clock in the afternoon, Monday, September 4th, 1882, when we switched over to electricity, that was a big problem for us because we gave up our source of minerals that we've been getting for thousands of years from our wood ashes and coal ashes. And suddenly now we didn't have that anymore. We wound up with all these diseases that doctors were saying were genetic. They're just simple nutritional deficiency diseases. So that's the problem.
Can I make a comment about water?
Go ahead, everybody needs water.
Yeah, we all need water. I have a friend that has a lot of problems, and he's been drinking reverse osmosis water. My understanding of reverse osmosis is it bleeds out the minerals, takes all the minerals out of the water. So I've cautioned him.
Yeah, and so they need to be, if they're going to use reverse osmosis water, they need to be taking our plant-derived minerals. They need to be taking the Healthy Brain and Heart Pack. They need to be supplementing very heavily. And of course, again, water is like soil. You can have one creek that has 14 minerals in it. You go 50 miles away and you got another creek that has 50 minerals in there, okay? And you go over to Japan and they have 75 minerals in there. And then you go to another place, they don't have any minerals in there. And so this is why you have different diseases that are common in different areas, because people aren't getting their nutrition as much or as frequently as they did prior to electricity, okay? When everybody was using wood ashes and coal ashes as fertilizer and also as as a supplement in their food, guess what? We didn't have a lot of these problems. But once we went to electricity, we didn't have access to that source of minerals anymore. And suddenly we had all these diseases. Doctors didn't know what they were. And they blamed them on your genes. They said, oh, it's a genetic thing. That's why everybody in your family's got it. No, it's because everybody eats the same recipe.
So, Doc,
Okay.
I'd like to speak on the water, something you taught me very early on when we met. We were talking about distilled water and reverse osmosis, and you said that those waters are perfect water, except they're hungry because they don't have minerals in them, and they will strip minerals from your body because they got to have the minerals in it. God created water with minerals, and when you take them out, then it's hungry water. So when you add 1 ounce of our plant-derived minerals per gallon of distilled or reverse osmosis water, you now have perfect water.
Well said, you get 100.
Thank you, Doc. Okay, guys.
Laura,
Yeah,
Lori, got
hi.
a question?
Yeah, just real quick. Hi, Doc. I just wanted to touch base with you and give you feedback on the treatment that I gave my mom when I was in Italy. She, we applied the minerals to the skin. I did that sort of a skin application as you had suggested for the pastor that was in a coma. So I thought, well, I have nothing to lose. My mom's leg is not healing. So I'm going to do this while she's bedridden. And she improved. She has improved. I did that treatment for two times a day, 1 hour a day, 1 hour each. And we did that for about 12, 13 days. 2 of 3 days before I left, she started noticing that her bone where it's broken was starting to heal. Well, she didn't know that. She said, well, it's starting to hurt. And which was very interesting. And then I found out that it's a sign that the bone is healing. But the main takeaway was the fact that the nursing home where she's staying at was the people there, the nurses and the workers that are helping her. They were very interested. And I generated a lot of interest in what I was doing and for our products too. So I just wanted to share that with you. I
Well,
don't
good.
know. Sorry, go ahead.
I was going to say, just let us know if they begin to use this in some of their patients in those nursing homes. That'd be a wonderful thing.
Oh, that would be fantastic. I was wondering that should be, even this treatment shouldn't that be something that we could promote to nursing homes, like the skin
Absolutely.
application?
Go for it.
Okay. All right. I figured you wouldn't have a problem with that.
Yep, it'll definitely do good things. And again, we have the book Dead Doctors Don't Lie. We have the book Epigenetics. We have the book Rare Earths Hidden Cures. We have the book It's All in Your Head. And these things doctors don't know this information. So when you get these books, and of course, the holidays are coming up.
Yep.
And so if you're going to give somebody a gift and they're in your business, why not give them a book or a CD set or something like that? Or our new flip chart coming out. Our flip chart will be coming out here in a week or 10 days. We're very excited about it.
Yep.
And it goes into many of the diseases we found causes, prevention, and cures for that nobody knew. They all thought it was genetic. And so, and many of the famous people we help with their health issues, there's pictures of me with those famous people and so forth. And so that flip chart is going to be a very, very good holiday gift, regardless of what faith you're in or what financial level you're in. Along with the flip chart, the book, the WALLACH Revolution. The WALLACH Revolution it introduces people to me if they don't know me. It says, who's this guy? And so the WALLACH Revolution is 75 years of my work and studies and all my degrees and so forth. And so that goes along with the flip chart, the WALLACH Revolution. And it's a great, great, great gift to give somebody if they're, like college kids, they wanted to be a nurse or a doctor or a chiropractor or a naturopathic doctor, or they want to be a pharmacist or whatever. These books will be an enormous benefit to them. Okay, so, and you get a tax deduction because it's a way of increasing your business. Okay, to hand these books out as a holiday present. Okay, so it's a tax deductible. You get many, many benefits. It grows your business, it's tax deductible, and it helps people. Can't get any better than that.
Absolutely. No, that's a great idea. Well, thank you. When my mom gets her next x-rays, I'll let you know
Okay, please.
the status of the bone. But anyway, thank you very much.
Thank you. Bye-bye.
Bye-bye.
Thank you. Thanks, Doc. Thanks, everybody. Appreciate y'all. We'll see you next week.
Okay, bye-bye. Bye, Pam. Bye, Dave. Bye, team.
Bye, Doc.
Good.
Thank you.
Bye, everyone. Thank you.
See you
Bye-bye.
next Wednesday. Good night and a better tomorrow.